Carol Stone, the HR Director for the City of Midland. And before I turn it over to Blue Cross so you can learn more about Medicare Advantage and the Silver Sneakers program, I thought I'd take a minute and talk a bit about why the city's making this change. Pension and unfunded healthcare liabilities are the biggest issue facing the city today. With healthcare costs escalating, we knew we had to make some changes to make sure that your retiree healthcare plan was sustainable for the long term. Our first priority has been and will continue to be making sure that we honor our commitment to you, and we think the Medicare Advantage plan does that. We've, in most cases, matched or increased your medical coverage. The one area we weren't able to improve upon or match was those of you with the $2, $3, $5, or $10 prescription copays, and I'm sure you've seen that in the summary of benefits that was provided to you. For those of you that are covered under those plans and have had name brand prescriptions in the past year, we will be issuing you a subsidy to help offset the cost of those plans to give you time to work with your physicians if there are lower cost alternatives before you're hit with that $30 prescription copay. There'll be time after the presentation for you to ask questions, but if you have specific questions that pertain to claims that you've experienced, if you could hold those till the end of the presentation and then meet with the representatives individually, they can answer your questions that are more related just to you. And with that, I'm going to turn it over to Tangi Haynes from Blue Cross, and she will go over the Medicare Advantage plan.
Thank you, Carol. Hello, everyone, and thank you to the City of Midland for allowing Blue Cross Blue Shield of Michigan to share some important information with you today regarding your health care coverage. My name again is Tangi Haynes, and I'm a Medicare Advantage representative at Blue Cross Blue Shield of Michigan. And just a couple of things before we get started. I do want to let you know that my goal and our goal as the representatives here today is to assist you and make sure that you walk out today knowing more than you did when you walked in. We want to make sure that you have all your questions answered, so there's quite a few of us here today to assist you if you have specific questions. Just as Carol mentioned, if you have specific questions about the plan, please stick around at the end and we will sit down with you individually. There are quite a few different benefit designs, so if you ask a question about your plan, it may just pertain to you. There's so many different options available to the retirees, so we'll be happy to sit down with you. Secondly, there is a group of people here today that are not quite Medicare eligible, so just know that you will not have the packet of information that was mailed to everyone else. So I understand that you were invited just to hear this information and to get the information for you once you retire, and you'll have an idea of what to expect. I want to first start out by making sure all of you have a presentation. This is the slide presentation that we'll be reviewing. So if you don't have one, please raise your hand and we'll make sure that you get one so that you can follow along with me if you'd like to. And with that being said, we'll get started. So today's agenda, once again, is to explain the benefits of the Medicare Advantage plan. This plan goes into effect September 1st, 2016. So we'll go into great detail about the Medicare Advantage plan. The name of the plan is the Medicare Plus Blue PPO. That is a group plan you'll see that on the materials that you receive, but it is a Medicare Advantage plan with a Part D prescription drug plan. We'll also review benefits at a glance. We'll make sure you have information so you'll know how to contact us if you have questions. And then at the end, we'll open it up for any questions that you may have. So I'd like to start out by making sure you have a clear understanding of Medicare, the original Medicare plan, and how your plan currently is set up versus the way it will be administered beginning September 1st. So right now, all of you have your red, white, and blue card. On the card, if you'll notice, there is a Part A and Part B. Part A includes your hospitalization benefits, your skilled nursing facility, inpatient benefits. Your Part B includes your doctor services, all your professional and outpatient services, including your durable medical equipment. That's the way it's set up now. You have your original Medicare, you have a Medicare supplemental plan that that is combined with the original Medicare, and then you have a separate part prescription drug plan. So on the left side of the screen, that's the way it's currently set up. Medicare Advantage is also known as Part C, and it incorporates everything all under one umbrella. So you have your original Medicare, you've worked long years to become eligible for that. So you always keep your original Medicare, but we combine original Medicare with additional benefits that is included all in one umbrella. So you have your prescription drug coverage, you have some additional benefits that you currently don't have with your Medicare and Med Sup plan that we'll talk about in just a few minutes, but it's all covered under one umbrella, and it's also referred to as Part C. The prescription drug portion, you may have heard it referred to as Part D. That's the prescription drug, but the Part D, the Part C, it's all included in one plan. So just to give you a little background, back in 2003, there was a Modernization Act that was passed, and that means that many private insurance companies, such as Blue Cross and many others, have a contract with the federal government to administer Medicare Advantage plans. These plans, again, are offered by insurance companies, private insurance companies all over, and it offers all of your rights and protections that you currently receive with your original Medicare, in addition to some other benefits that are included. So it's not referred to as a supplemental plan as you currently have. Again, it's referred to as a Medicare Advantage plan. So once again, just to reinforce the way it works, Medicare Advantage plans include Medicare Part A benefits. It also includes Medicare Part B benefits, supplemental benefits. It's a comprehensive plan, all included in one package. So in order to be eligible for a Medicare Advantage plan, you must have Medicare Part A, Part B, and you must continue to pay your Part B premium. Currently, for those of you who have Medicare Parts A and B, the Part B premium is currently taken out of your Social Security check, so that will continue. You must reside in the United States, and if you are not 65, you can be eligible for Medicare Parts A and B if you're disabled. And those of you who are not Medicare eligible in the room, you will retain your current health plan coverage with the City of Midland that you currently have. So let's talk a little bit about how it works. Currently, for those of you who are married, you have your plan and your spouse, and you're considered a two-person plan. If you have a dependent, then it's a family plan. The difference between what you currently have now and how the Medicare Advantage plans are set up, the Medicare Advantage plans are all individual plans. And this is a little hard to get used to because it's much different from what you've had all these years. If you are married, you will have your card, your ID card, your spouse will have her ID card, and you will both have different numbers and different plans altogether. So they're just completely separate individual plans. So that's one difference that you'll experience. Non-Medicare eligible dependents will continue to have their coverage under the current Midland plan if they're not eligible for Medicare. So these are terms that I'd like to make sure all of you understand before we move forward. Many of the terms that I'll review with you now may not impact your plans because, as I mentioned, there's quite a few plans that you all have, and some of you don't have deductibles or co-insurance or co-pays for that matter. So just bear with me as I explain these terms just so that you understand how they work in case you do have deductibles or co-insurance on your plan. So a deductible is your cost share for select services before the plan's cost share begins. So if you have a $500 deductible, if you have services, you have an inpatient service and it's $2,000, you are responsible for the first $500. That's just an example. Co-insurance, it's your cost share after the deductible has been met for select services. It's usually a percentage. So once again, an example would be if you have a $500 deductible and a 20% co-insurance. Then a copay, you probably are pretty familiar with a copay because that's usually what you pay when you have a doctor's office visit. You go in and you may pay $5 or $20. That's a flat dollar amount. The out-of-pocket maximum, I'd like to spend a little bit of time making sure you understand what that is. I have people they usually get alarmed by the out-of-pocket maximum, but I want to warn you that it's a good thing. It's a safety net that you have in place. All the Medicare Advantage plans have an out-of-pocket maximum. What that means is, let's say, for example, that out-of-pocket maximum is $1,000. That simply means that once you've paid your deductible, your co-insurance, and your co-payment amount, once it totals the $1,000 out-of-pocket maximum, you've paid all that you are responsible for to pay in a given year. So it's a safety net. Once you've paid that $1,000, if that's your out-of-pocket maximum, all your covered services are paid at 100% at that point. So it's a safety net for you, and so that you will not have to pay over that out-of-pocket maximum amount. So once again, it includes your deductible, your co-insurance, and your co-payment amounts in 1 year. So let's say you've had a pretty tough year and you've had multiple services and you've paid $1,000 in the month of March, beginning in January, and then in March you've met that out-of-pocket maximum. For the remainder of the year, for your covered services from March until the end of the year are covered at 100%. So it's out-of-pocket maximum. It's what you've paid out of your pocket in a year. Okay, so hopefully that's clear. If not, we can talk about it a little bit later. So all of the plans, all of the Medicare Advantage plans include the core benefits that you currently receive. So your inpatient hospitalization, your routine medical care, your surgical services, allergy, radiation if you need that, and diagnostic testing. All of the core benefits are included in the Medicare Advantage plans, as well as some additional advantages of having the Medicare Advantage plan. You have one ID card. So right now, when you have services, you show your red, white, and blue card, and then you show your Blue Cross card, correct? With the Medicare Advantage card or plan, it's only one card. So that's keeping it a little simple for you. It's easy and efficient. So you have one card because, once again, everything is incorporated in one plan, and that's the Blue Cross plan. So you can put your Medicare card at home somewhere safely, put away so that you'll have it when you go to the movies, and you can get your discount on your movie theater tickets, right? So you can put that red, white, and blue card away. You have one summary of benefits, and the summary of benefits is what you've already received in the mail. You should have received a packet. It's a pre-enrollment information packet, and it includes a summary of the benefits that you will receive in the plan. You have only one, and then you have one explanation of benefits. Right now, you receive one from Medicare, and then you receive a Blue Cross explanation of benefits. With the Medicare Advantage plan, you will receive only one, as well as one dedicated member services department. We have a Medicare Advantage member services call center. We only receive calls from those members who have Medicare Advantage, and then there are no provider referrals required. So it's, one of the idea behind the Medicare Advantage plan is to keep it simple and easy and efficient. So once you receive your card, which those will be mailed mid-August, somewhere around August 15th or so, right before the effective date of September 1st, on the back of the card, you'll notice that there is the customer service phone number, so you will have access to that if you're out and traveling, or if you need to call us. It's very convenient on the back of your ID card. The way the Medicare Advantage plan is recognized on the ID card is in the front, there's what looks like a suitcase, and it has MA, that stands for Medicare Advantage, and then on the side it says RX, so that stands for the prescription drug. So once again, both are included together, so you have the one card, and it's the only card you'll need for your medical and your prescription drug benefits. You have preventive services included. For those of you who are new to Medicare, you have a Welcome to Medicare visit that you're eligible for the first 12 months of turning 65, so keep that in mind. But all of the screenings, colorectal, glaucoma, diabetes, all of the screenings included here. And there are several more. Sometimes each year we add on additional screenings that are approved by the Medicare folks that are added to this list, but those are the exams and screenings that you have access to as a Medicare eligible beneficiary. So the Medicare Plus Blue prescription, or Medicare Plus Blue and Prescription Blue plan ratings are very important to the Blues. Each year, the Centers for Medicare and Medicaid Services, you'll hear that area of the government referred to as CMS, they rate us based on how well we handle member issues, how well we manage chronic conditions, and a host of other criteria that is set forth by the Medicare, by CMS. So we are rated in 2016, the rating is a 5-star rating scale. Blue Cross Blue Shield of Michigan has 4 stars. So we continue to strive for the 5-star rating. We implement different plans and different programs into our Medicare Advantage department to ensure that we strive and reach the criteria that the CMS department sets forth for us to ensure that we rate highly in the different areas. There is no 5-star plan in the state of Michigan, so we are right. We're very proud of the 4-star rating. So we're rated every year. So I just want to tell you that so that you know that we are, the government just reviews and makes sure that we are on target with the things that we need to do to ensure that we provide an effective plan for you. So the prescription drug plan is a little bit different. There's 5 tiers. You currently have 3 tiers. Each tier determines the copay, and if you have a flat copayment amount, then this won't affect you at all. Some of the plans have a flat copayment amount, and some plans have different copayment amounts depending on the tier. Tier 1 includes your generic drugs. Tier 2 are your non-preferred generic drugs. Tier 3 includes your preferred brand name drugs, and 4 includes non-preferred brand name drugs, and then Tier 5 includes specialty drugs. The specialty drugs are the higher cost drugs. The cost is $600 in cost or higher. Those are the more complicated disease states. Cancer and some of the other disease states fit into the category of Tier 5. So you are eligible for mail order, a 3-month supply. You do have a discount. If you receive a 3-month supply, you pay in some cases only 1 copayment or 2 copayments, depending on the plan that you have. You can pick those up at a retail pharmacy, or you can have them mailed to you. If you're out of state, there's national chains like such as Target or Kmart. Walgreens is a good national chain as well. 98% of the pharmacies participate. You won't have any problem transitioning to the pharmacies. All the pharmacies are the same. The current plan you have, Midland made it very easy for you, sticking with Blue Cross. So whatever pharmacy you're currently using, you can continue to use that pharmacy. No changes. The pharmacy network is online, as well as the formulary, and the formulary is a list of drugs that are included in the plan. So I have a formulary list with me, and if you have questions today about any drugs that you're taking, you want to just take a look at the formulary that we have on the Medicare Advantage plan, we can help you take a look at that. I have Renee Carlisle, who is our pharmacy manager here from Blue Cross Blue Shield of Michigan, to answer any specific or any more involved questions that you may have regarding your prescription drugs. She's here to assist you, and she can sit down with you one-on-one after the presentation if you have some specific questions. If you're traveling, the plan utilizes a national network, which means if you're out of the state of Michigan and you have services rendered by a provider that accepts Medicare and the PPO, then you can use your Medicare Advantage card. We have a program, it's called Blue Card. If you need assistance with finding a provider that's near the area that you're traveling, we can help you, and we can also help you with any claims that you have incurred outside of the state of Michigan. Silver sneakers. My colleagues and the folks here from Midland may laugh because this is my favorite benefit, and I think we all get a little excited about silver sneakers because I actually wish I had silver sneakers in my plan. There's a flyer on the table over where Vicki is sitting, and it is a nice way to stay healthy and fit, and if you want more information about it, we have flyers. But it's an exercise program that includes thousands of healthcare facilities. We were at the community center last week where we had a presentation, but the Midland Community Center is included. But it's an exercise program at no additional cost. It's included in your plan. You can exercise and have access to the amenities there at the workout facility. Their exercise equipment, in some cases, their swimming pool and sauna if they have one. But it's a nice way to stay fit and stay healthy. You can also call and receive a box of workout equipment, the stretch bars that you get that you can work out at home. So you have access to going out to any of the facilities if you travel. It's a nationwide program. What will happen after you're enrolled, after September 1st, shortly after, you'll receive a packet in the mail, you'll receive a card, you have access to all the facilities. If you have questions about any of the facilities other than the Midland Community Center, then you can call Silver Sneakers, and that information will be included in the packet. And you can tell them that you're traveling to Arizona to visit your family, and you really can't miss a workout day because you love to stay healthy and you want to work out as often as you can. And they can take the zip code of the location where you'll be staying and tell you the closest place that you can go. All the Ys are included, so it's a really nice benefit to have access to. There's also program advisors, much like trainers, that can help you, with a program that's just for you to, like a trainer can help you work on different areas that you'd like to. So it's a really nice program. I can go on and on, but I think I'll just move along here. We also have a care management program, and to be honest, this is also one of my second favorite benefits because it's a comprehensive set of services that are available to you and included at no additional cost in the Medicare Advantage plans. There's a host of care management programs available that will help you stay healthy and manage any chronic conditions that you have. There's also programs if you're smoking and you'd like help to stop smoking. Your care management nurse is available 24 hours a day. There's a 24-hour nurse line that is available 24 hours a day, 7 days a week. So it's a very comprehensive set of services that are available to you. If you're in the hospital, we have programs such as care transition to home. It makes sure that you have everything you need if you're transitioning from the hospital to home. And then a Care Plus provider home visit program. So if you have questions or you'd like an overview of some of the programs available, there is also a booklet on the table over here like this that you can pick up and take with you. We also have behavioral health services. These services are available to you at no additional cost as well. If you have emotional or issues with stress that you'd like assistance with, then you can call our behavioral health case management folks, and they can help direct you and help assist you with resources that are available to you. We have some fun things that we'd like to talk about, make sure that you are aware of them. We have discount programs, much like what you hear about with AAA. You show your card and you get a discount. There's a website that we have, and it's on the materials that you have. There are discount programs. Sometimes they have new things added, but some of the things that are on the website are discounts to the zoo. If you show your card, you get a discount. If you have grandchildren and you want to go to the Great Wolf Lodge in Traverse City, there's a discount there. So there's quite a few discount programs that we make available to you. We have vendors that we work with to provide discounts to you just from showing your Blue Cross Blue Shield of Michigan card. And then there's a magazine. It's will be mailed to you quarterly, and this magazine is just a nice way to have healthy tips and recipes mailed to you in a booklet, and It's nice and useful information for you to have. We have an exceptional customer service department. Shortly after you're enrolled, you will receive what we call a welcome call. So you will have another opportunity to ask questions, and we will be more than happy to assist you, because what typically happens, as you know, once I sit down and you all leave here and you go to lunch and you think about a question that you can't believe you forgot to ask, you'll have many more opportunities to ask that question, but the welcome call is a nice opportunity to ask our customer service representatives anything that you may have forgotten, and then they can explain some of the other details of the Medicare Advantage program. Everything's on the web. The website is listed on this page at the bottom. Your formularies are on the website. The provider directory is on the website, as well as some other information that you have access to. So if you have time to check that out, please do. Once again, the plan effective date is September 1st. So you have the current plan that you're in until August 31st. There's some important information that you'll want to know. When you turn 65, I know because I have a mother that's a little over 65, you receive so much mail. You receive everything. Everybody knows how old you are. The government tells everybody. So you get so much mail. And some of the plans that you may receive in the mail look really good, but you'll want to make sure that you know that you can only have one Medicare Advantage plan at a time. So if you enroll in another Medicare Advantage plan or a Part D plan, it will kick you out of the current plan that you're in. You will no longer have the City of Midland Medicare Advantage plan. The government will only allow one Medicare Advantage plan at a time. I know I was told that there were some calls that came in asking questions about other plans that you may have through a spouse. I'll tell you that if you have a supplemental plan, it won't interfere with your Medicare Advantage plan. However, you will receive a letter in the mail from our Coordination of Benefits Department. They will want to know what plan you have, and so that we can coordinate the plan. So just please keep that in mind, that if you enroll in a standalone Part D prescription plan or a different Medicare Advantage plan, you will be automatically disenrolled from this Medicare Advantage plan. Okay? Once again, the phone number to our member services department, as well as the hours and the website, if you'd like to call us and ask questions. We won't have information about your plan until September 1st, so if you have questions before then, you'll want to maybe reach out to the city or talk to us after the presentation once again today. So I want to bring up a couple of things that I already know have been questions. Oh, you know what? It's not. It's the summary of benefits. There is a summary of benefits, thank you, that was mailed that had a statement, and I don't have it in front of me, but it's about catastrophic coverage. I want to make a point of talking about that. Perfect. Thank you so much. So the summary of benefits, we have copies here if you received it in the mail. There was concern about the very last page, and I want to talk a little bit about that. It's in reference to the pharmacy program, and it just says that after your yearly out-of-pocket drug cost, including drugs purchased through your retail pharmacy through mail order, reaches the $4,850, you pay the greater of 5% of the cost, or $2.95 co-payment for generics. I just want to let you know that many of the plans that you have currently have a very low prescription drug copay. So if you reach this out-of-pocket cost, which is a lot of prescription drugs, but if you do have a catastrophic situation and you do have drug costs that reach this amount, then you will, this is again a safety net. It's a good thing. I think it comes across negatively, but it is very positive, because this is a way of making sure that you pay the lower cost, either 5% of the cost or $2.95 or $2.95. co-payment at that point. But once again, what I want to mention is you will never pay more than your Medicare plus Blue Group PPO co-payments or co-insurance. In your case, it would be a co-payment amount. So you will never pay more than you are currently paying for your prescription drugs. And if your co-payment happens to be a bit higher than this, then this is a safety net. This is the lowest cost that the government is offering you to pay for your co-payments if you have prescription drugs that reach the $4,850. And Renee, I don't know if you want to talk any more about that. If did I capture everything or anything that you think needs to be added?
No, I think you did capture it.
Okay.
I can answer the questions individually.
Okay, very good. With that being said, we will open it up for any questions, and just raise your hand and we'll answer any questions that you may have. Did you have a question?
If we're on a lower prescription copay, do we stick with that then, or are we changing to?
So the question is if you're on a lower co-payment for prescription drugs, if you change or you stay with that. And Carol, do you?
So for the lower prescription copays, for the $2, $3, $5, and $10 copays, they have changed. For generics, you'll have no copay at all. And for name brands, it'll be $30. And as I said at the beginning, we recognize that's a big change, and we will be issuing a subsidy to you. We'll be sending checks out September and January probably, that will be based on your past 12 months usage. So if you've had name brand prescriptions in the past 12 months, we will be issuing a check to help offset those costs for you, to give you an opportunity to work with your physician to see if you can do something lower cost.
Is that every year?
Right now, it's just the first year, but we will take a look at that.
Well, thank you everyone for your time, and once again, we will stick around to answer any individual questions that you have. Thank you so much.